Good morning, everyone. I am Gabe Albornoz, Chair of the County's Health and Human Services Committee, joined by my colleagues and Chair of our Government Operations Committee, Councilmember Navarro. We are here for our second work session as a follow-up to our discussion regarding the proposal to require vaccinations of county employees. And I'm just going to state the obvious here that a lot has changed and a lot has happened since our initial work session on this important issue prior to the holidays. And I'll note that we will review and discuss and begin to process all that has changed since what occurred prior to the holidays. And it feels like forever ago, but we had just started to hear about a variant coming out of South Africa identified as Omicron during our last session, never imagining the challenges that it would reap on our operations here at the local county level, and frankly across the entire country, and once again the world. And so we had a very robust work session with the situation that was on the ground at the time, with the information that we had at the time regarding vaccinations and spread. But again, all of that has changed. And I just want to say up front how extremely appreciative all of my colleagues and I are to all of our county personnel and frontline employees who have continued to report for work, who have continued to ensure the health and wellness of all of our county residents, and whose leadership has been extraordinary. But as we will hear soon from our colleagues in the executive branch, we know that operations were strange. As some examples include, our fire and rescue department had to scale back operations, fortunately for a short period of time, but to address the amount of first responders that were not able to report to work, either because they had COVID or somebody in their immediate family had it. And as we know with Omicron, unfortunately, it meant that even people who were fully boosted had a number of breakthrough cases, including our own county executive. Now, of course, the great news is, as we continue to believe strongly here in our community, vaccinations are critically important and probably the most important tool in our fight against the virus, as evidenced by over 80% of the people who were hospitalized over the last 6 weeks within our hospitals were people who were unvaccinated. So we know that the vaccination is important, is critical, and that is not what is up for discussion today. What is up for discussion is a follow-up to our last work session where we discussed the operation on the ground, how those operations have been impacted, and how or if it will impact our deliberation over our conversation this afternoon about the requirement. I do want to set expectations because prior to us scheduling this session, we didn't know that the county executive would be announcing a very important initiative that several of my colleagues from both committees would like to attend, in which we are announcing some additional support and security for our faith-based organizations in light of the terrible rash of hate crimes that have occurred across the country. And that is at 12 o'clock. And so we will aim to finish this work session today by 11:30. And given the mounting new pieces of information, it's unlikely that we will complete this work session within the hour. So there will be a third work session scheduled as soon as possible to follow up on whatever it is we don't get to this morning. So I wanted to set those expectations. And before we get to the 141 pages in this packet, and I really want to credit our central staff, who I know worked collaboratively with the executive branch and the county attorney's office to help answer our questions and do a really great job providing some feedback. And I know there are some amendments that have been proposed that I'm not sure we will get through today, but we will see how far we get. So with that, I yield to my colleague and friend, Chair Navarro, to make some opening comments as well on behalf of the Government Operations Committee. Chair Navarro.
Thank you so much. I appreciate the opportunity to have this work session. I think that you have described very well how everything has been extraordinarily fluid in our experience, especially with this Omicron wave. But I do want to take this moment to thank our employees. When we look at the data that is included in the packet, we see a very high rate of vaccinations in the vast majority of our departments. I mean, literally, there are only basically like 4 outlier departments. And I think it is so important to recognize that although we know, as you stated, that it does not mean that you cannot be infected, that you cannot contract COVID-19 if you're vaccinated and boosted, it does mean that it will be a milder case. I had that experience in my immediate family. And I think that there is more and more a recognition that it is going to be so critical for us to also think about our neighbors, our extended family members, et cetera. And so I do hope that given the very high vaccination rates in the vast majority of the departments, that, that the administration continue to think of important strategic targeted initiatives, use tools to incentivize, but maybe even require some higher benefit share or something of that nature to those that do not want to be vaccinated, because as we look at the data also of hospitalizations, we've seen time and time again reported that I think something like upwards of 70% of the hospitalizations are because of unvaccinated patients. And so it does make a difference, and we want to set the example. So I do look forward to this and the next session to understand, absent a straightforward mandate, what would be some of those targeted strategic tools that the administration can utilize to raise the vaccination rates in these 4 particular departments. Thank you.
Thank you so much, Councilmember Navarro. All right, so for context and at a high level, Ms. Wellens, if you could just sort of set the stage, and then I would like to, after you do that, turn it over to the executive branch and starting with Dr. Stoddard to describe the current situation on the ground, how things have changed, what the efforts have been since our last work session to get more people, more employees vaccinated, but then hear from our corresponding directors of respective departments on operations in light of what's happened the last several weeks. So Ms. Wellens, if you could just provide a high-level overview of what's in the packet for us to discuss, that'd be great. And then we'll turn it over to the executive branch for some opening comments.
Great. Thank you very much, Mr. Chair. Thank you, Chair Navarro and council members. Good morning. I'm joined by my colleagues, Ms. Rodriguez-Hernandez and Mr. Camacho, who did extensive and thorough research for background that's shown in your packet. And of course, during the first work session on this bill, council staff discussed with you approaches of other jurisdictions and some data from other jurisdictions to the extent that that data is available about employee vaccination mandates in other places. And in addition, there was some discussion with executive staff as well as labor partners regarding various concerns about potential implementation of the bill, discussing potential impacts upon employee attrition. And in that regard, there were some specific follow-up questions of committee members, including staff was asked to look in a bit more detail to the approaches of other neighboring jurisdictions, particularly other Maryland jurisdictions. I believe that Councilmember Katz had asked about about retirement eligibility in our county versus in other counties where vaccine mandates have been implemented. And there are also a number of potential amendments that are discussed in the packet to the extent that the committees have a chance to look at those today. I believe that that's the general overview. Again, well, just to follow up on the specific questions, and Ms. Rodriguez Hernandez and Mr. Camacho could follow up on this in more detail should you have questions. But I believe that in terms of Councilmember Katz's question about the retirement, based on what we've learned from the executive staff, it looks like about 30% of our employees are eligible for retirement. We are not really sure how that compares to other jurisdictions, although Ms. Rodriguez Hernandez was able to determine from, I believe it's Montgomery College, who's implemented a mandate, has about a 40% eligibility for retirement. And anecdotally, they've had just, a handful of individuals who have retired, who have noted that their retirement has been due to the vaccination requirement. Ms. Rodriguez Hernandez, is there anything else that we should be updating kind of in this general overview?
Sure, just quickly, yes. The 3 points were about religious exemptions, retirement, and progressive discipline and how that impacted vaccine rate after the fact. So just continuing on the retirement factor, as Ms. Wans noted, about 40% of Montgomery College staff were eligible, and only a handful noted that the mandate was a reason for retirement. Just a few. And it's the same picture for MNC PPC and for Montgomery County Public Schools. As of November 1st, 7 MNC PPC staff members declared that they were intended to retire or did retire. That's after the mandate. It could be because of the mandate, but of course, we are not sure of all of the definitions because the organizations weren't able to formally track this. And finally, for Montgomery County Public Schools, about 13 staff members are eligible for retirement this year and into next. And only about half a dozen mentioned the mandate in retirement exit interviews for that as well. So just very few members in each of our local jurisdiction, of our county jurisdiction, institutions, sorry, I apologize. For the religious exemption and the criteria they used, they followed similar methods for both Montgomery College and Montgomery County Public Schools, including a form for them to file a statement of, alleging their sincere belief and faith. The college and the school system work to authenticate that using references or following up with questions. And for Montgomery College, staff members could deny appeal their denial if they were to be denied for their exemption. And in Montgomery College, 82 folks or staff members have a religious exemption, and 21 have a medical exemption. For Montgomery County Public Schools, 701 employees have a medical or religious exemption. And finally, looking into progressive discipline and the impact on choosing to get vaccinated or submitting an exemption request rather than leaving or being terminated. At Montgomery College, 300 staff members were sent a non-compliance warning letter. And of those 300, 20 were suspended without pay. But at the end, only 1 member was terminated because the other 19 chose to either submit an exemption request or they were vaccinated or started the vaccination process. For for MNC PPC, when they began their policy or implemented their policy, in the deadline for non-represented and for FOP, there was about a 30% increase to 85.4% of their staff was vaccinated. And as we know, McGeo was then also required to submit proof of vaccination. And by their December 1st deadline, it increased another 6%. So at this time, about 97.2% of staff are at least partially vaccinated. And for Montgomery College, 97% of their staff is vaccinated. For MCPS, we know at their deadline on November 15th, 93% were vaccinated, and beginning their progressive discipline now at 2 months later, 96% are vaccinated. So that was religious exemption retirements and information on progressive disciplines, which were follow-up questions the committee requested at our previous work session. And I'll also turn to Mr. Camacho if he has anything else to say.
I'll just add that we added some information on other regional jurisdictions. So we looked at 11 regional jurisdictions in Maryland, Virginia, and the District of Columbia. And so we found that jurisdictions with the most stringent vaccination policies were Washington, D.C. and Tacoma Park, which have vaccination mandates with no test out option. And those two jurisdictions are actually mandating a booster for eligible employees. Also, the city of Rockville is mandating a vaccination policy for its employees. However, it's unclear whether employees must be boosted as well. The data that I received a couple of days ago seemed like only a handful of employees were terminated due to non-compliance in the city of Rockville. And then we have Fairfax County, Arlington County, Prince George's County, Baltimore County, Baltimore City, and Anne Arundel County, who have a vaccine or test option. And then Howard County does not have a vaccine mandate for government employees, but does have a vaccine mandate for Howard County public school employees. And then Frederick County does not have any vaccine mandate in place, but they do have a financial incentive in place. And Baltimore City and Anne Arundel County also have financial incentives in place to increase their vaccination rates. I'll just leave it at that. If you have any questions with regards to other national jurisdictions that we've looked into, happy to try to respond to those.
Well, thank you to all three of you. That is extremely helpful and provides a really great overview and context. I'm now going to turn over to Dr. Stoddard to speak on behalf of the administration, discuss things at a high level and get as specific as he feels comfortable at this point. And we do have some questions coming in from colleagues, from the outset as an overview, starting with Councilmember Reamer, one of the co-leads for this bill. So Dr. Stoddard, I'll turn it over to you. And if you want to defer to some of your colleagues in the executive branch, feel free to do so as well.
Thank you, Council President Alvarez, Chairwoman Navarro, and thank you other members of the County Council for having us here today. I'll give a very quick introduction, and then we'll certainly defer to some of the department directors who have gotten to experience this more on the ground level and the struggles that Omicron has presented. So I'll start off by saying, obviously, we still continue to believe that vaccination is an absolutely critical, important part of this overall COVID response. Is the most important thing people can do to respond to Omicron COVID generally. Being boosted is important and absolutely does provide protection, as Chairwoman Navarro referred to, particularly for hospitalization as well. It does, however, obviously Omicron has been very different in terms of preventing transmission, as we also have already alluded to this morning. Omicron vaccination against COVID only confers approximately a 50% reduction, according to the most recent studies published this week, to transmission of Omicron, which is markedly down from the 80-90% we saw with earlier variants, including Delta. So obviously the protection afforded to transmission is just substantially different with Omicron. And obviously we don't know what a future variant will look like with regard to vaccination. So we are still encouraging and will continue to encourage employees to be vaccinated. I'm really glad that Chairwoman Navarro discussed the possibility of insurance implications. And so we are working with the employee unions around a proposal to actually incentivize by reducing those who maintain their vaccination status to be current. Because I think the key thing is with any legislation that the council would consider, there may be future boosters or other requirements that to maintain that up-to-date status. I think you Council President Alvarez have talked about when we talked about the vaccine requirements, a out-of-date passport, as it were. We want to make sure that any incentive that we create encourages employees to stay up to date with whatever the current vaccination level is as part of moving forward. And so we are definitely interested in looking at additional ways to incentivize or to encourage employees to be vaccinated. Educate, and I think as we've talked about, even with the vaccine requirement for businesses, there are some people who are pretty entrenched in their position, and we have to really try and educate them and address the reasons why they are hesitant to provide. And the only other thing I will provide, we did get an update from the CRISP system, which is the state system that allows us to, we provide them a list of employees who are currently unreported. They tell us this percentage of those employees appear on the list. And therefore, some of the departmental numbers that we can get into will be higher according to our CRISP report. For example, I think in our county report, Department of Corrections and Rehabilitations is sitting at 65.3%. Looking at the CRISP data, it's actually 73.4%, or sorry, 73.9%. So while they are still the lowest department, according to the CRISP data, it is nearly a full 10 points higher than what's reflected on the county dashboard, because the CRISP system can tell us. We don't know which of the employees in that pool is unreported. Like, we don't know by name, but we do know by department that there are some higher percentages there. And so our overall vaccination rate in our employees is at 87.4%, according to the CRISP report. And so just wanted to give that additional data that we did receive just this morning from CRISP, and that's through January 18th. At this point, I'm going to turn it over to a few of the directors on the call, just to have them give some updates about the implications that we saw during Omicron with staffing availability. And I think maybe having Director Talley, because I think some of the corrections issues were most prevalent. And then I don't know if Chief Goldstein is on, but sort of I think here from you, yeah, Chief Goldstein is on. So Director Talley, if you want to give some context for what you saw.
Sure. Good morning, everyone. Yes, Omicron was a different variant for us. It was a fast mover, which was the good news and the bad news. And I will say that we are already short-staffed. Everyone knows the struggles with recruitments and public safety in general. And as we're all competing with the jurisdictions, our neighboring jurisdictions, for staff members, as other people are making different career choices, whether that's stay at home, retire. And public safety is one of those less desirable career paths at this time. And so you're already going in with a deficit in staffing. And so at times, we were 23 short on a shift. And if you can imagine running a correctional facility with 23 short on day shift, 23 short on evening and night shift, there are many security vulnerabilities when you don't have that many staff members, because you can't keep drafting people over and over again because you don't have available staff. And so our staff were being impacted, and those who either vaccinated, unvaccinated, we're coming down with Omicron. Of course, the inmate population, those cases increased to the highest they had ever been, because we had the highest cases load we'd ever had inside our facility was maybe max 30 cases. And so everyone was being impacted. There were posts that were unsecured. We were shutting down posts at both facilities, at the MCDC 7 Locks intake facility and also at MCCF. And anytime you do that, it's dangerous. And you have to stop movement, which also has the other impact where the population that you're serving are unhappy because there's no movement going on. Everything's at a standstill. And so that increases the security and other vulnerabilities for our staff, for incidents that were occurring inside the facility. And so we have always been hit, even during regular times, with staffing issues. And Omicron just really magnified that to another level, where we had to actually start using some of the new CDC guidelines with some of the quarantine, and being able to test our asymptomatic staff members. And if they tested negative, try to get them back earlier than the 10 days. And it was a lot of moving parts. At one point I was down to 2 lieutenants to run a shift. And we had to keep drafting sergeants to fill this role as lieutenants. And so it was pretty hairy. I believe we're at a better place today. But with the unknowns of what may hit us next, not sure. We stopped training. We stopped a lot of things that put us at a deficit. And so we're trying to get back in the next couple of weeks from where we were, but it was a serious, challenging time for us.
And Chief Goldstein, did you want to provide some additional context as well from a fire rescue perspective?
Absolutely. Thank you, Earl, and to all the members of council. The descriptions, as Angela provided, and the ones that President Albernaz, you mentioned at the beginning of the session, were indeed challenging for fire rescue, and ones that we were surprised by the Omicron surge. And Earl shared some of the information with you today, FRS has a total of 22 folks unavailable, 20 career, and 2 volunteers that are actively out due to COVID sickness or COVID quarantine. That is down from our high of 168. We hit the 168 mark on January 3rd. And when we communicated with you right after Christmas on the 29th, we had seen an extraordinarily rapid uptick. We had been running in the 20s to 30 members a day out with sickness or quarantine throughout the most of the fall. And as December came, that number rapidly went up. Now we know it was Omicron. We thought it was the gathering results of Thanksgiving events. And the cumulative impact of over 10% of the career workforce at a few days out sick, in addition to our staffing situations, which have some parallels to corrections and Angela's discussion, made it so that we were forcing people to work, similar to Angela's drafts, forcing people to work in the double-digit numbers right around the Christmas timeframe. And the impact that we implemented on the 29th of when we had to force people to work and limit positions did have an adjustment to our availability to the community. Luckily, and I am amazingly grateful to the men and women of MCFRS, over a week-long period of time during the highest point of our surge of the Omicron activities, the men and women working extra shifts, signing up for additional voluntary overtime, we succeeded in only having 5 days in which our staffing was challenged and we needed to adjust the level of service that we provide to the community on a daily basis. So between the December the 30th and January the 8th, there was 5 days where we had adjustments. Even when we got to the January 8th and 9th, even then we're almost at 100 people a day out sick. We still had capacity within the organization through overtime, voluntary staffing to answer the calls. And it is my immense thanks to the men and women for their capabilities there and their dedication to the community. Indeed, the third surge was one that challenged FRS, challenged every part of the industrial community and all aspects of the workforces, and the opportunities to keep touch with President Buttle on a daily basis. And I will highlight how our numbers are now down to the early December numbers, enables us to take a second, take a breath, and continue on answering, roughly the 350 911 calls a day. So the support from the community, the support from the members, support from the legislative branch, and you all as council members is greatly appreciated, and it indeed has been a challenge through this last month.
I think the last thing I'll say, and I think turn back over to you, Council President Albornoz and Chairwoman Navarro, is that obviously we are still concerned about what the long-term implications will be of termination, particularly in some of the departments. Obviously, we've had very great difficulty, particularly within the public safety space. I heard Director Talley talk about this last week in a budget session. Filling positions is incredibly difficult right now. So it would not take a significant number of lost staff, either to retirement, transfers, or other things, to severely impact long-term, because those positions, would not be just short-term from someone being on a quarantine or out with COVID. They would be long-lasting in the sense that they're now positions that just have to be filled we have vacancies in many of the public safety departments, particularly also transportation bus drivers we talked about as part of the pay increase. We've had challenges in filling some of these key positions where we still have concerns that losing even what seems like a small number of people in those operations would just exacerbate existing issues. And finally, the last thing I'll say is, and we probably need to have this conversation broadly about the public as well, but something like 20 to 25% or more of our population is likely to have been infected by Omicron during the surge. And we should consider how that, what that means in terms of the immunity that one has reflected moving forward. We've long sort of had established that a previous infection with a previous variant reflects something like equal to 1 dose of the vaccine, not a full vaccination. Vaccination is better, provides better immunity, more diverse immunity than a single infection would. But obviously it's not zero either. So I think that that's an important thing potentially for us to think about. We've seen similarly high levels of infection in our workforce, both amongst the unvaccinated and the vaccinated, in nearly equal measures. So I think it's important to understand that contextually moving forward, what that means for the future immunity to other variants that one might consider as part of this vaccine mandate for employees. So I think we'll stop there and certainly available to answer all the questions that you have.
Thank you, Dr. Stoddard. Once again, colleagues, we're going to try to stop by 11:30. We will follow up on this discussion shortly after this at a future date and time that won't be in the very distant future. But first up, I have questions. I'm going to yield those for right now. First up is Councilmember Reamer, one of the lead co-sponsors for this bill. Councilmember Reamer.
Thank you. Thank you to our committee chairs, and appreciate our conversation today. I wanted to just briefly ask if council staff could get a little bit more detailed information out of MNC PPC. I understand that they have, additional information about the number of employees who ultimately decided that they would rather remain unvaccinated, and it was quite low. I want to just make a very general comment. I know we're not voting today, but for me, the experience of Omicron has really emphasized the importance of this policy. And, the data that we've been provided today shows much higher absentee rates, or leave rates for unvaccinated county employees. It's double for the unvaccinated than the vaccinated. And we should expect that it's coming back. Omicron COVID's not going away. It's I don't know if it's here to stay, but it's not going to be disappearing. And it seems more likely that we'll have an Omicron wave next winter. So we need to be prepared for that. And we can avoid larger staff outage from ensuring vaccination. And not only that, but boosting. We got to be current, because there is a big impact. And I grant you that infection is also highly effective as promoting immunity. However you get it, your immunity boost, but at the same time, it's very dangerous to just get infected as a way to promote your immunity. I mean, that's Russian roulette. But I think that we are experiencing massive impacts from staff that are sick, and we ought to try to minimize that however we can, whether it's bus drivers or building service workers in the schools, or it's bus drivers in the county, or firefighters or police. As a critical services employer, I think that it's more important for us to have vaccination requirement than less. And I guess that's just the bottom line. And I appreciate the conversation about healthcare. I'm glad. I apologize, I came in late, so I didn't get a chance to actually hear that question. But that's a great one to ask. Why should county employees who are vaccinated pay for those who are not when they get sick? How is that fair? We all know that these work. And if employees had to pay for their own healthcare, how would they then feel? But again, as an employer, providing critical services. I think that the imperative of this is clear now with massive disruption to our workforce, and we will face far more harm by not having vaccination requirements than we will if we do have them. So I look forward to coming back to this soon. Thank you so much.
Thank you, Councilmember. Actually, my question was regarding the comment you made about insurance as well. So maybe Dr. Stoddard, if you could just spend a moment or two talking about or elaborating on what you're working on. And I know there are members of the Office of Human Resources here as well. After you guys respond to that, I then have Councilmember Friedson followed by Councilmember Katz.
Yeah, we're really getting involved in these discussions with the unions. Certainly McGeo, I see Lisa is here and may one comment have shown some interest in this, where it's really it's reducing the insurance premium pay-in for employees who maintain current vaccination, meaning not just your 2 doses, not just even your single boost. If another boost were to come along, you know, in order to maintain the benefit, you would have to continue to maintain. We really are just getting involved in these discussions because this is something that actually Mr. Madaleno had seen done elsewhere, and we were extremely interested in pursuing. So we're in those discussions now, and I'd be happy to provide an update as we get further into those discussions. But that's sort of what we're thinking, is really to try and, you know, to reward the employees who stay current by having it reflected in what their insurance premiums is. I think we all agree that particularly amongst the unvaccinated, the probability of more severe outcomes that ultimately have to be subsidized by insurance that the county provides is a thing. And so I want to make sure that we're clear that you know, we would continue, you know, we would want to incentivize people to do the healthy things like we do with Live Well and other programs. We incentivize people to you know, lead healthier lives because it has a back end consequence for what the county has to pay out in terms of insurance. I would also want to say one thing to Councilmember Reamer's point about I'm not encouraging people to not get vaccinated and use natural immunity as a way to I want to agree with your point there that we don't want to have people doing that, but I think it's just a matter of reflecting that some people were vaccinated, still got Omicron, and are likely to also have an immunity boost moving forward. I don't want to encourage anyone to go out there and seek Omicron infection as a mechanism to subsidize their own immunity.
Right. But if I could just, sorry, it's not my question. Immunity wanes. I just want to make that, so a year from now, 10 months from now, we know if people aren't current, this is coming.
Chair Navarro actually brought up the insurance concept a while ago, and I know wants to get in on this now. Chair Navarro.
Thank you, Mr. President. Yes, the reason why I brought that up in my introductory comments, obviously, it's something that the Government Operations Committee and at times this joint committee has addressed with the notion of, you know, cost reduction, but also making sure that we have a workforce that is well. I mean, when it was mentioned about all of the wellness programs, the Live Well programs, those are programs that we launched collaboratively with the previous administration because we understood that this was going to be critical. Now, now we have arrived at this moment where we have this interesting intersection with yet another negative indicator for health. I mean, we talked about things like smoking, et cetera, but now we have a situation where I am also convinced that I don't think we are necessarily completely done with sort of this yo-yo effect. And if indeed, short of a straightforward mandate, I think that people need to take then personal responsibility for that. And it does have not just an operations impact, but it also has a fiscal impact to the county. And it's not fair for those employees who have decided to step up, and do the right thing for the collective to then not reap the benefits of that and have to subsidize other people that have just decided that for personal choice. I do think that's a very important tool that we need to explore. And I assume that we need to do that before budget because, we are going to be, I think, deliberating on a lot of different pieces. So there's not a lot of time. And I think this should be prioritized as another important piece for us to be able to react to sooner than later. Thank you, Mr. President.
Great points. Councilmember Friedson, followed by Councilmember Katz.
Thanks. On the insurance premium, I just want to point out and I think it's instructive of this entire conversation. I had suggested that back in August when the original Board of Health regulation that I drafted and colleagues unanimously supported, in coordination and constructive cooperation with the executive branch, under the context that the executive branch was already moving forward and wanted to have a more aggressive approach to what I originally had envisioned, and several council members were hoping at a minimum to set the standard for. So I find it frustrating as part of this entire conversation that those conversations about the insurance premiums and about, you know, carrots and not just sticks for employees to incentivize vaccines that have real life consequences, not just in the health and wellness of the total workforce, but in costs. And I will say, in the fairness question, the biggest unfairness, I think, is to taxpayers who are already subsidizing our public workforce for a substantial portion, the vast majority of their healthcare costs, and are paying more in a self-insured situation like the county has for those who have made decisions, personal decisions for whatever reason, not to protect themselves to the greatest extent that they can. It's the taxpayers who are largely subsidizing these decisions by employees. So I will say that this particular aspect with healthcare reflects the awkwardness of this situation. Doing this legislatively is very challenging. This should be done, should have been done by the executive. In most jurisdictions around the country, these are executive level decisions, and I believe that the council has moved forward with what we have because of the executive's unwillingness to do this and failure to do this. I was ready to vote at the last work session with changes, including a more progressive discipline approach to this. I'm ready to vote now. I understand that we're not going to be taking the vote today, but I just wanted to note that. And I do think that this conversation has been a bit frustrating because the very same arguments for why we shouldn't have an employee vaccine mandate, the exact opposite arguments on the exact same data points were used just this week with the vaccine passport proposal. And there is a bit of do as we say, not as we do in county government right now. And I am very uncomfortable with the notion that we are at the same time encouraging every single resident of the county to get themselves vaccinated, get themselves boosted, understanding how much that impacts their family and their coworkers and everybody around them and themselves. And yet we are unwilling to hold ourselves to the same standard as a family in county government, as we are asking every family in Montgomery County to hold themselves to. I understand and appreciate and respect the entire workforce. I understand that there are very strong feelings about these issues. I understand that the regulation as drafted needed to be tweaked and adjusted, and I have supported several of those. I've drafted a few of those, but the idea that we have not moved forward on a reasonable standard to require every single county employee to be vaccinated as the standard for the county, and that we're unwilling to send that type of message and be consistent in our message with county residents makes me extremely uncomfortable. And I just, I've said before, I'll say again, we got to lead by the power of our example, not just the example of our power. And we are not leading by the power of our example right now. And that just makes me extremely uncomfortable. So I'll yield back to you, Mr. President, or Mr. Chair.
Thank you, Councilmember Friesen.
May I respond to some of that?
Yeah, go ahead.
So I think council, I take some, I have to push back some on that, Councilmember Friesen, because I think that it's important to note, I think the council legislative staff presented and suggested that the majority of jurisdictions have a vax or test program, which is exactly what Montgomery County has at this point. That was reached in agreement with our unions from the county executive's direction. And so I don't like the suggestion that we're doing that less than what the vast majority of jurisdictions are doing. And in fact, many states, including Connecticut, which is not a hyper conservative state, are actually withdrawing their vaccine test programs because they've gotten the progress that they want to see, just like we've seen with more people being vaccinated. I think there are many jurisdictions who would be extremely pleased with the level of vaccination in public workforces that we've achieved here in Montgomery County. So I take, I have to push back and say that, I think that we're going a little bit extreme in some of the judgment here. I think we're talking about, 5, 6, 7% of our employee population would be the difference between a mandate and what we have achieved already. And I'm not saying that 5, 6, 7% doesn't matter, but if it comes at the expense of 2 or 3% of key departments leaving, that's the resistance that we've had to a mandate where we have to terminate employees as a result of said mandate. And so there's never been a suggestion that vaccination wasn't important, but it seems, I think you're right. Some of the arguments used against the vaccine passport are being utilized as well, in the sense that our rates amongst our employees are pretty comparable. And I think you even said we should focus on education with our public. We're focusing on education with our employees as well. And so I think, it cuts both ways, sir.
Thank you. We've got Councilmember Katz, followed by Council Vice President Glass, and then Councilmember Rice. Councilmember Katz.
Thank you very much, Mr. President. When we look at the chart, does the percentage of the total employees that are vaccinated, does that include those who are exempt?
We do not have a exemption process for current employees, meaning we have not asked current employees to submit a religious or medical exemption. We've certainly got some interest from the unions to be able to do a process like that and start a process like that to reflect how many would submit. Right now, the only medical exemption or religious exemption that we allow is for a new employee coming in. We require new employees coming into the system to be vaccinated before hiring, and they can apply for a medical or religious exemption. So we have a process, and I certainly think there is interest from our labor partners on potentially doing a process like that within, we've been sort of tracking how the council was going to proceed with this particular mandate to understand what kinds of exemptions would be allowed before we went down the road of trying to do that. I certainly think we could have discussions with them and start to figure out how many would seek exemptions. But I think it comes down to what you're willing to accept as exemptions. Some, Seattle, for example, I think we've talked about this previously, have allowed pretty broad exemptions for religious and medical. Other places have denied nearly all of the religious exemptions that have been asked for. And so it really depends on the level of scrutiny you're willing to apply to someone's religious exemption request as to whether that's a viable mechanism to allow people to seek those exemptions.
Well, and I appreciate that would have been difficult at this point to ascertain. However, if you include, there's going to be some people, whether we agree or disagree, there would be some people who are going to receive medical and religious exemptions. So that would cause these numbers to be higher than what they are that we're seeing here. And so I think that's something that should be noted. At some point, you're never going to get to 100%. There are going to be religious and medical exemptions. You're never going to get to 100%. What is the percentage that is what we would consider to be 100% in these numbers?
Well, I think even the CDC's, when looking at full population, has sort of capped things out at 95% just because there's uncertainty associated beyond that. I think 93 to 95% is probably likely if you were to mandate. It's just no matter what happens with that other 5 to 7%. I think that I've previously testified. I do think a vaccine mandate would result in more employees being vaccinated. It's just the question of how many more would be vaccinated, how many would seek exemptions, and how many would leave as a result of the requirement. And that's really the question that we struggle to answer, because it may not be large numbers that we're talking about on the aggregate across all of county government, but if they're focused in one or more programs, that's the trouble that we run into. And I think that's the struggle that we are trying to figure out exactly what, if we granted broad religious and medical exemptions, I presume that 5 to 6 or 7% of the employees would seek those exemptions, and if they were granted, then I don't think there would be an issue. It comes down to what the veracity with which you judge exemptions are.
And I'm going to be very respectful of the time. I know that we have others that want to speak, but I think bottom line is, with me, is I am extremely concerned that people are not, those that did not get the vaccination did not get it. I believe everybody should get it. I believe everybody should be boosted. I believe that everybody would be much better off to have it. But I am also extremely concerned if in the God forbids in life, if somebody calls 911 and we don't have the personnel to respond to that person's fire or horrible situation, life-saving in many cases, if we don't have the personnel to respond, that's a horrible situation, and perhaps is even worse than of any of the scenarios that we would possibly have. So I do believe that we need to do the carrot rather than the stick. I do believe that we need to, in whatever ways that we can get people to do the right, what I consider to be the right thing, and get the vaccinations. But we also have to figure out a way how we're going to continue to serve our public during those emergencies, and for other employees as well. So with that, I could go on, but Mr. President, I'm going to turn it back to you.
Thank you, Councilmember Katz. Council Vice President Glass, followed by Councilmember Rice.
Thank you, Mr. President. Good morning, everybody. So I've been taking a lot of notes during this conversation, and I will try to be brief. I will be brief, but I have a lot more thoughts than I'll be able to express during this session. So I appreciate that we'll have another session to talk about this. So at the last joint committee hearing that we had, I raised the issue about insurance premiums. And at that point, OHR Director Attila told me that there was no function just yet, and that there was no communication from the insurance companies about how to mitigate or how to adjust for those who have received their vaccinations and or boosts and those who haven't. And so I'm glad to hear that conversation has evolved a little bit. I know it's not unique to us, it is national. But when I had last asked it at the last meeting, it was still a novel idea. So I'm glad we're moving in that direction. I know he's not here, but hopefully there's somebody else, or Dr. Sardert, you can answer some of these questions as well. It's my understanding that when people are hired by the county, they have to undergo a physical examination. Isn't that correct?
The nature of I'll let Mr. Gorman, I think he's on from OHR, but I believe it depends on the nature of the position as to what their physical entry requirements are. Mr. Gorman, can you elaborate?
That is true. In Montgomery County, I'm trying to get my camera on. In Montgomery County Personnel Regulations, Section 8, the requirements are generally listed with a review by the employee medical examiner, depending upon the class specification for the position. And we have hundreds of class specs, so each one will be different.
And thank you for that, and nice to see you, Mr. Gorman. So without looking at that regulation in front of me, I presume that there are vaccinations and other things that are required, right? Not COVID right now, but other vaccinations, right?
I would assume so, but I can't say precisely that would be the answer. It's simply because there are hundreds of class specs that are even more precise than Section 8 of MCPR.
Sure. Well, I'll note for the record that I would appreciate learning what those requirements are. Maybe not for all the 100 or so specs that you're referring to, but understanding what is currently expected of county employees. Because I'll share with you, I have a vacancy in my office, and we have a job posted, And part of that job posted, we were required to write the following. I'm going to read from the job posting. Effective August 30th, 2021, all new hires will be required to provide proof that they are fully vaccinated against the COVID-19 virus prior to their first date of employment. Individuals who are unable to get vaccinated should contact OHR at montgomerycountymd.gov to discuss possible accommodations. So I think this opens up a lot more questions because, one, I've been instructed to add that language requiring all future employees, but Mr. Stoddard, that goes back to a point that you were saying earlier, that there is no accommodation or way to note that accommodation, but I've been instructed by OHR to write that language in our job posting.
There is for new hires, there is a requirement that you have COVID-19 vaccination. There is a religious exemption process there, and there is a medical exemption process there that exists for COVID-19 vaccinations. Just to give you just a brief description of that process for religious exemptions, there's actually a form that you complete. I'd be happy to provide that form to the council if we have not already. It's a religious exemption form. That form goes to the EEO office within OHR, who reviews that. They'll consult with the county attorney's office, and I think Ms. Kinch is on, and she helped develop the form, so she can speak a little bit more to this. They review that process, and then they make a determination in concert. They make a recommendation to the office, to the OHR director, and the OHR director then acts on the recommendation that's provided as to whether to accept or reject the medical exemption or the religious exemption form. Medical exemption is through the OMS system. So you make a medical evaluation of the person's rationale. Similar determination goes to the OHR director, and then they decide whether the person is going to be hired or not based on the requirement. So my point was, we haven't, once they're obviously a member of the county and then part of the union, you have to obviously discuss the form and all of the procedures with the unions, which we're not opposed to doing. I think the unions are happy to do that. It's the question of whether, if we give you an exemption, would the exemption that we provide you meet whatever standard that is being proposed by this council bill? And obviously, I think the original iteration of the bill did not include a religious exemption. And so OHR granting a religious exemption to a current employee that would not be then reflected in this potential mandate would obviously be problematic. And so I think we'd be happy to engage with the unions around that discussion. I think there's real interest from all the unions around having an exemption process if such a mandate were to move forward. And we could preemptively have that discussion so that the council would better understand what is likely to come with a mandate. But we have not done that because it seems to be getting cart before the horse a little bit.
Okay, well, I'm looking at the time. Again, I have a lot more questions. I will hold them. I'll engage with you privately or whenever else this comes up before the body. But for now, I'll yield back. Thank you. Thank you, Mr. President.
Thank you, Council Vice President Class. Those are great questions, as was all of my colleagues. I'd suggest that we, and we will, put together a memo with some of those questions as a follow-up so that we can make the next workshop even more productive than this one. Councilmember Rice.
Well, thank you very much. And I really appreciate that line of questioning, Councilmember Glass. So thank you. Very insightful. And to all of my colleagues for really trying to help us to just understand where the executive branch is, as well as where our colleagues in leadership of the various departments are, as well as where our union partners are in representing our many employees. And want to also share my thanks for those who continue to work on the front lines for all of their continued dedication. I did just want to ask Dr. Stoddard, if you could just sum up for me, what is the executive branch's position when it comes to, and just in general terms, I don't need to get into specifics, where are we in terms of ensuring that our folks get vaccinated, not just because of fellow employees, but also for the public? Is this a priority for the executive branch in terms of making sure that we get this done quickly and effectively? Because to Councilmember Friedson's point, it does seem as though we've been talking about this for quite some time, and it certainly does not, our actions here in the council do not preclude the county executive from moving forward with doing something that may be different from what's been proposed by lead sponsor Councilmember Reamer. So I'm just curious, where is the county executive and the executive branch when it comes to trying to make sure that this happens or not?
Yeah, so we strongly believe vaccinations is an absolutely critical part of protection from COVID-19, both for the benefit of the employee, less benefit in Omicron for protecting others, because obviously we can still be infected and transmit at, with Omicron at much higher percentages than previous experience. However, obviously it comes down to, I think Councilmember Katz got to this, which we're just not inclined to have to terminate particularly key personnel around this mandate, because losing providers to us is more deleterious than having them be unvaccinated.
Thank you for that. Thank you for that. So what I'd like to understand is how you identify key personnel and the percentages and the numbers. So I'd really like to understand that because are we talking about entry-level folks who are the majority? Are we talking about majority senior level staff who have tremendous impacts in terms of upending departments? Have you done that deep of a dive in terms of who these individuals are, and if you had to replace them, what that would mean for the impacts on the various departments? Or have we not done that deep a dive when it comes to analyzing what that potential loss might be and what the mitigation factors may be for that potential loss?
So we did obviously provide a snapshot of several months ago of, particularly within public safety, because I think that's where the majority of issues are in public safety that we have concerns about. We have some DOT, particular ride-on concerns specifically, but I think that's where the majority of our concerns lie, is within corrections, sheriffs, Montgomery County Police Department, fire rescue, and DOT, particularly ride-on services. Those are probably the key sectors where we have the most concerns, because those are the places where we're the most staffing challenged. And so any reduction in staffing would have a direct on-the-street impact on service delivery. Other areas could probably absorb. And I think that, other areas are, obviously more highly vaccinated too. So even the standout people there would have less impact potentially on the losses that would be experienced within those 5 departments that I've listed.
So understanding that, is there the potential for us to then do a deeper dive analysis and say, for those, because you alluded to the fact that if you did a vaccine mandate, you'd probably have some that would then begrudgingly go along with being vaccinated versus the number that you then lose. So taking that percentage out and then the number lost, and equate that, or not equate it, but compare it to the number of folks who have been out sick in any particular time. As we heard from Chief Goldstein, we had a bunch of folks who were out sick because of the COVID infection. And so from that perspective, we were able to unfortunately manage, but it's something that we were able to do. So I'm just curious about how those numbers conflate with each other, and if there's a significant increase above that, and if we've done that analysis to get to what the real number is and what that real pinch point would be for us in terms of still being able to provide services to our community.
Yeah, I think we did part of that analysis early on. I think Chief Goldstein could speak to this. I think it was about a 2% reduction. Anything beyond a 2% reduction in staff would result in service level changes, whether those be increased holdovers or, which obviously is not a long-term.
If I could just jump in, and how many were we short? What was the percentage that we were short from folks being out that impacted service for just a few days, thanks to the great men and women who stepped up? But what was that percentage?
Thank you, Mr. Rice. Sorry. Yeah. Thank you, Councilman Rice. At the time, that week between January 3rd and January 8th, we were at the number of 11% at the worst career personnel out. The expectation or the level of impact as we did our projections originally were in that roughly 3% arena of the workforce. And the nuance, as Earl talked about, in the loss of swiftwater boat operators and the loss of telecommunicators at fire rescue folks at ECC, or the loss of hazmat technicians, a loss of 3, 4, or 5 could drastically impact our operational capability of maintaining the same level of service that we have today if those were a part of the nearly 30 to 40 folks that would be in that 3%. The number of MCFRS members out sick throughout the vast majority of the Omicron surge or surge number 3, it was roughly 70% of the folks out were the vaccinated, and the remaining were unvaccinated or not reported, and that's the picture that we were looking at and working with. So, Councilmember Rice, I hope that information helped.
Yeah, it definitely did, but it makes me ask more questions as to whether or not we've determined whether, and I hear you when it comes to ECC. So have we identified and said that there are, 20 members in ECC that are unvaccinated, and so therefore the percentage, and done that kind of due diligence in terms of understanding impact? I hear theoretically what it may be, but we know what the numbers are. And so I really think that we need to do a deeper dive in terms of numbers. I'm a data guy, and so for me, it's like, what's the data show? And then let's cross-reference that with the percentages that we have that we're estimating, and based on what we're seeing, based on what you said, Dr. Stoddard, yourself, when it comes to those who would likely become vaccinated, and then determine what our risk truly is. At this point, we're just kind of speculating, and I'd like to have it based on more data than speculation. So I'll stop there, Mr. President, because I see that we're well past the time that you had identified, and I want to be sensitive to that. But I would like to have that question answered in terms of really starting to identify how many people in these various different entities or agencies that are really crucial, and we understand where the impact is, because then we might want to say for those particular entities, we're going to do something different, right? But for everything else, we keep it and go ahead with, because we don't have the same sort of challenges or concerns. And so, let's be creative and innovative in terms of how it is that we're doing this and approaching it, understanding. I completely understand what you're saying, but until we have the data that supports it, I think it's not beneficial for us to assume versus have that information. So back to you, Mr. President.
Thank you, Councilmember Rice. Chairwoman Navarro.
Thank you. In closing, I do want to support that request as well for the Joint Committee. Also, are there any particular conversations about targeted recruitment if there is a decision to move forward, especially since we are requiring new hires to be vaccinated? I mean, there is a disconnect there, and I'm glad Council Vice President Glass brought that up, that we have to take into consideration for sure. And so I do believe that we need to figure out, what are the different approaches in order to have an equitable situation. Right now, it's not equitable. We're requiring new hires to be vaccinated unless there are certain exemptions. Yet we have, current employees who are not. And so, I do think that we need to sort that out as well, and appreciate everybody's comments.
Thank you, Chairwoman Navarro. So thank you all. This has been a productive work session, and I think lays the groundwork for what will likely be our last work session on this topic that we will schedule in the very near future. I think we will expect responses to these questions and follow up, and any updates, obviously, to the plan that Dr. Stoddard mentioned that the administration is working on right now, acknowledging that it is true. As a former executive branch employee myself, it should be the executive branch that facilitates and leads as we look through to do this, and we prefer not to do this legislatively. So we will follow up, and then the expectation will be we will go through the various amendments as have been proposed, and then likely see if we are able to vote this out of joint committee after the next session. So this gives the executive branch a little bit more of a runway to work with our partners and stakeholders, including those leaders in labor, to come back with us with an enhanced proposal on top of what they've already been working on. So with that, thank you very much. Ms. Wellens, is there anything else as we close that you wanted to mention that I may have forgotten?
No, thank you, Mr. Chair.
Okay, so with that, we are adjourned. Thank you all.